Hi everyone, my name is Olanike Katibi. Um, I'm from University of Texas, Rio Grande Valley. This is class presentation, and I'm going to talk about effect of dietary modification at reducing symptoms of ADHD. I choose this as my research topic because um, I was a school nurse and I see the impact of ADHD on parents and their children. And I've been always want to do something about it. And so this, so I want to do something about it. So to start, ADHD, what is ADHD? ADHD is attention deficit hyperactive disorder. It's a common childhood neuropsychiatric disorder characterized by behavioral problems. And the disorder of ADHD is widespread. According to statistics, it affects 8.12% worldwide, affecting millions of children. And in the US alone, ADHD affects 6.4 million children aged between 4 and 17 years. And according to CDC, the cost of ADHD on the US economy is estimated to be $38 to $72 billion annually. There has been a promising research on dietary modification and its effects on ADHD, reducing symptoms of ADHD. So this piqued my interest because I know, beside the cost, if we can just find something that will help to alleviate the symptoms of this disorder and to help parents, it will be very good. ADHD has so many symptoms, which I will divide it into behavioral symptoms, cognitive symptoms, and mood symptoms. Beside the persistent pattern of inattention and impulsive behavior and hyperactivities, ADHD can manifest, the symptoms can manifest in the area of aggression, excitability, fidgeting, irritability, and the cognitive symptoms of it is absent-mindedness, difficulty focusing, forgetfulness, and it has also been shown that the lifelong lasting effect of ADHD on patients is the lifelong effects of it has been associated with psychiatric disorders such as opposition defiant disorder, conduct disorder, depression, and anxiety. And another area is it can even cause the social learning disabilities. And it is also believed that when the symptoms of this disorder is not well controlled, it might lead to drug abuse or criminal activities. Etiology of ADHD. ADHD has been known to cause, there are three factors that I can say will cause ADHD: the genetic factor, the environmental factor, and the stress factor. The genetic factor in the sense that ADHD is hereditability. it affects approximately 75%. That majority of the patients having first or second degree relatives with a history of ADHD. And not only that, research have shown that 25% of ADHD patients have parents who meet diagnostic criteria for ADHD. The environmental factor of ADHD has shown that ADHD can affect everyone is above, you know, not only low social economic class, but also it can affect people from family dysfunction and another one is the stress factor. Perinatal stress factor can affect it. Maternal medical diagnosis such as diabetes, high level of PKU, maternal malnutrition during pregnancy has all shown to contribute to the to ADHD. And biohazard factor of ADHD is the air trauma, tumor, strokes, and lead poisoning in children. How do we treat ADHD? Before now, there has been the only the only the one of the areas of treatment is the psychopharmacological treatment, which is and it is known that stimulants and non-stimulants medication are used to treat ADHD. Stimulants medications such as amphetamine, Concerta, Ritalin, Adderall, and Focalin, and non-stimulant like Strattera. But the problem with the psychopharmacological treatment of this disorder is the side effects. And the side effects like sleepiness, loss of appetite, stomachache, headache, elevated blood pressure has been shown in people with ADHD. And one of the side effects is also tic. And tic is known as the involuntary movement, a sudden involuntary muscular contraction, typically involving the face, the eyes, the muscle of those people who has this disorder. And because of that, researchers started looking into different other ways that the symptoms of ADHD can be controlled. And that is why I pick up interest in the dietary modification, because when you really look at it, all this medication is expensive. It has a big financial burden on families that have ADHD. So, and what we have come to find out is looking into the areas of dietary modification, because findings have shown the importance of restricted diet and even artificial food coloring, elimination of addictive food that will help in reducing the symptom of ADHD. And it has shown that there is remarkable improvement when dietary modification is applied to people, to patients with ADHD. And from this research, I want to work with parents and with children that is affected with this disorder, to remove the removal of artificial coloring and sugar, including sweetened drinks, candy, and colorful cereal from their diet. Not only that, I know the importance of collaboration with other healthcare personnel like nutritionists, dietitian, and to bring everybody together to work on this to see how to see how this um, research changes, these changes can help to alleviate, to remove, or to reduce the symptom of ADHD. Another area that I want to going into is the removal of allergens from like wheat, milk, and food that with salicylate uh, should be removed, should be removed from food to do research to see that this is removed so that and see the impact it will have on the patient. The most important is education. Educate, educate, educate. Educate the parents with uh, children of ADHD and the children too on the harmful effects of addictive food, of dye, preservative, on the that on the harmful effect of all this food that is having on the disorder. Another area that I want to go to is to encourage parents for to supplement uh, omega-3 fatty acid in the diet of the children with ADHD, because research has shown that omega-3 fatty acid works well and help to remove uh, to reduce the symptom of ADHD. Lastly, I want to incorporate diet that emphasize on fruits and vegetables, whole grains, healthy, unsaturated food, and physical activities. You know, physical activities. I want to incorporate it so as to help in reducing the symptoms of ADHD. Um, and in all of this, as an experienced nurse, um, caring for, going through this, going on this research and caring for people with ADHD, I want to ensure that the I want to ensure that taking care, doing this and removing all this, and to continue with the research in order to find other ways that ADHD is that the symptoms of ADHD is reduced or removed completely, and to provide service that will improve my patients' day-to-day function and overall quality of life. Thank you.